Let me ask you something before you scroll past this. When was the last time you woke up and your mouth felt like you had been chewing on sand all night? Like someone had come in while you were sleeping, vacuumed every drop of moisture from your mouth, and left you desperately reaching for a glass of water before you even opened your eyes fully? If that sounds familiar, I need you to stop right now, because what I'm about to tell you is something most people completely ignore, and honestly, most doctors don't spend nearly enough time explaining. That dry mouth is not just annoying. It is not just a minor inconvenience. Your body is sending you a signal, and if you keep waking up and brushing it off, you may be missing something that could seriously affect your long-term health. I'm Dr. Mia Walker, and in this video, I'm going to walk you through exactly what's happening in your body when you wake up with a dry mouth, why it matters far more than you think, and what you can actually do about it starting tonight. No fluff, no filler. Just real information that you deserve to know. So let's start at the beginning. What is dry mouth, scientifically speaking? The medical term is xerostomia, and it simply means your salivary glands are not producing enough saliva to keep your mouth adequately moist. Now you might be thinking, okay, Dr. Mia, I probably just slept with my mouth open, no big deal. And yes, sometimes that is part of it. But here's what most people don't realize. Saliva is not just water. It is one of the most underrated substances in your entire body. Saliva contains enzymes that begin digesting your food before it even reaches your stomach. It contains antimicrobial proteins that fight bacteria and viruses in your mouth. It buffers the pH in your mouth to protect your teeth from acid erosion. It even contains growth factors that help heal small wounds in your oral tissue. When saliva production drops, even while you sleep, your entire oral ecosystem shifts in a direction that can cause damage that accumulates quietly over months and years. Now here's where I want you to really pay attention. Waking up with a dry mouth occasionally is one thing. But if this is happening to you consistently, multiple mornings a week, your body is giving you a persistent signal that something in your system needs addressing. Let me walk you through the most common reasons this happens, because understanding the cause is the only way to fix it properly. The first and most common culprit is mouth breathing during sleep. When you breathe through your mouth instead of your nose at night, the airflow rapidly evaporates whatever saliva your glands are producing. You wake up parched, sometimes with cracked lips too. But here is what most people miss. Chronic mouth breathing during sleep is often caused by nasal congestion, a deviated septum, or, and this is a big one, obstructive sleep apnea. Sleep apnea is a condition where your airway partially or fully collapses during sleep, forcing your body to compensate by breathing through the mouth. If you wake up with a dry mouth and you also feel exhausted even after a full night of sleep, if you snore, if you wake up with headaches, or if your partner has ever told you that you stop breathing at night, I want you to take that seriously. Sleep apnea is associated with an increased risk of high blood pressure, cardiovascular disease, stroke, type 2 diabetes, and even cognitive decline over time. And dry mouth is one of the quiet early signs that people live with for years before they ever get evaluated. The second cause I want to talk about is medication. This one catches so many people off guard. Over 400 commonly prescribed medications list dry mouth as a known side effect. We are talking about antihistamines, antidepressants, blood pressure medications like diuretics and beta blockers, bladder medications, anxiety medications, antipsychotics, and many over-the-counter sleep aids and decongestants. If you recently started a new medication and you have noticed that your mouth has been drier in the mornings, this could absolutely be the connection. I want to be clear that I am not telling you to stop your medication. Please never do that without talking to your prescribing physician. But I am telling you that this is a conversation worth having with your doctor, because sometimes there are alternative medications with fewer effects on salivary flow, and there are also things you can do to counteract this side effect. The third cause is dehydration, and I know that sounds obvious, but hear me out because most people dramatically underestimate how dehydrated they are chronically. Your body loses water throughout the day through breathing, sweating, urination, and digestion. By the time you go to bed, if you have not been drinking adequate water, your salivary glands simply do not have enough fluid to work with through the night. The general guidance of 8 glasses of water per day is a starting point, but your actual needs depend on your body weight, activity level, climate, and overall health. A simple check is your urine color. If it is dark yellow or amber by the time you are going to bed, you are going to bed dehydrated. and your mouth is going to pay for it by morning. The fourth cause I want to mention is alcohol and caffeine consumption in the evening. Both of these substances are diuretics, meaning they cause your kidneys to flush out more fluid than usual. Having a glass of wine or a cup of coffee or tea too close to bedtime can significantly reduce your hydration status overnight, and your mouth will reflect that by morning. This is also why people often wake up with a headache and dry mouth after drinking alcohol at night. It is not just the alcohol itself, it is the dehydrating effect working on your system for hours while you sleep. Now I want to talk about something that gets very little attention in mainstream health conversations, and that is the relationship between dry mouth and oral health deterioration. This is deeply important. When your mouth is dry at night, the bacteria that naturally live in your mouth, and there are hundreds of species in there, have an environment that is far more favorable for causing harm. Saliva normally washes bacteria off your teeth and gums and neutralizes the acids they produce. Without it, acid levels rise. The bacteria that cause tooth decay, primarily a species called Streptococcus mutans, multiply more aggressively. Gum disease bacteria also thrive in dry, acidic environments. So if you have been waking up with a dry mouth for months or years, and you have also noticed more cavities than you used to get, or your gums seem more sensitive or inflamed, these two things are likely connected. Chronic dry mouth is one of the leading under-recognized contributors to accelerated dental decay in adults, and dentists see this pattern constantly in patients who have no idea why their oral health is suddenly declining. There is also an emerging area of research connecting oral health to systemic health, and it is absolutely fascinating. We now know that the bacteria associated with gum disease have been found in the plaques that build up in arteries, in the joints of people with rheumatoid arthritis, and in the brain tissue of people with Alzheimer's disease. I am not saying that dry mouth directly causes these conditions. The science is still developing and the relationships are complex. But what I am saying is that dismissing oral health, and by extension, dismissing what your dry mouth is telling you, as just a dental issue is a mistake we can no longer afford to make. So let's talk about what you can actually do. Because I do not want to leave you with just a list of problems. I want to give you real, actionable steps that you can start implementing tonight. The first thing I want you to do is take stock of your breathing. Tonight, when you go to bed, make a conscious effort to breathe through your nose. If nasal congestion is making that difficult, try a saline nasal rinse before bed. These are widely available, inexpensive, and genuinely effective for clearing nasal passages. There are also nasal strips that you can apply across the bridge of your nose to physically open your nostrils wider during sleep. These are not glamorous, but they work for many people. If you have a bed partner, ask them to notice whether you are snoring or breathing through your mouth. And if there is any reason to suspect sleep apnea, please talk to your doctor about a sleep study. A diagnosis can genuinely be life-changing. The second thing is to build a proper hydration routine around your sleep cycle. Start drinking more water in the afternoon and early evening so that you arrive at bedtime in a well-hydrated state. Keep a glass of water on your nightstand. If you wake up in the middle of the night with a dry mouth, a few small sips of water can make a significant difference. Avoid drinking large amounts right before bed if you are prone to waking up to use the bathroom, but consistent, moderate hydration throughout the day is the goal. Third, look at your evening habits around alcohol and caffeine. I am not here to tell you never to enjoy a glass of wine. But if you are waking up with a dry mouth regularly, try cutting off alcohol and caffeine at least 3 to 4 hours before bedtime for a week and see if you notice a difference. Many people are genuinely surprised by how much this single change affects how they feel in the morning. Fourth, talk to your doctor or pharmacist about your medications. Bring a list of everything you take, including over-the-counter products and supplements, and ask whether any of them could be contributing to reduced salivary flow. This is a legitimate medical question, and a good physician will take it seriously. Fifth, consider your sleep position. Sleeping on your back tends to encourage mouth breathing and can worsen snoring and dry mouth. Sleeping on your side is often better for keeping your airway open and reducing the tendency to breathe through your mouth. This is a simple adjustment that some people find makes a noticeable difference. And sixth, speak with your dentist specifically about this issue. There are saliva substitutes and oral moisturizing gels that are designed to help people with chronic dry mouth maintain oral health protection overnight. There are also prescription-strength fluoride treatments that your dentist can recommend if your teeth are showing signs of the kind of acid erosion and decay associated with dry mouth. These are not cures, but they are tools that can protect your teeth while you work on addressing the root cause. I also want to touch briefly on some medical conditions that can cause reduced salivary function, because I think it is important for you to have this information. Sjogren's syndrome is an autoimmune condition where the immune system attacks moisture-producing glands, including the salivary and tear glands. It is actually more common than most people realize, particularly in women, and dry mouth is one of its hallmark symptoms. Diabetes, both type 1 and type 2, is also associated with dry mouth, partly through dehydration caused by high blood sugar, and partly through effects on the salivary glands themselves. Radiation therapy to the head and neck area can permanently damage salivary glands, and certain nerve conditions can affect the signals that trigger saliva production. If your dry mouth is severe, persistent, and not explained by the lifestyle factors we have discussed, please do not just manage it at home. Get evaluated. There may be an underlying condition that needs medical attention. I want to close with this. We live in a world where we are very good at tuning out the quiet signals our bodies send us. We are busy, we are tired, we are moving from one thing to the next, and something like a dry mouth in the morning feels too minor to warrant real attention. But your body is always communicating with you. These signals, the ones that seem small and easy to ignore, are often the first language your body uses before it has to start speaking louder. Waking up with a dry mouth every morning is your body's way of tapping you on the shoulder and saying something here needs your attention. I'm Dr. Mia Walker, and I genuinely care about you having this information. If this video helped you understand something you have been experiencing and not quite knowing what to do about, please share it with someone who might need to hear it too. Subscribe to this channel because I make videos like this regularly, and I want to make sure you never miss information that could genuinely make a difference in your health. And leave me a comment below telling me how long you have been dealing with morning dry mouth. I read every single comment, and your experience matters. Take care of yourself tonight because you deserve to wake up feeling good.